first we begin with breaking news. New Zealand's COVID streak could be over as health authorities urgently investigate a possible case of community transmission. A woman has tested positive for the disease after leaving hotel quarantine. Health authorities spoke a short time ago.
As has been indicated earlier, this morning we received information from the Ministry of Health about a person in the community who has tested positive for COVID-19 after they have left our managed isolation facilities. This afternoon I've been meeting with the Director General of Health, Dr Bloomfield, and a number of the other health officials to discuss the situation. Health's incident management team has been stood up and is now working on the case. The case is a 56-year-old woman who has recently been through isolation at the Pullman Hotel in Auckland after returning from Europe. She tested negative twice during her stay and was released following that. We don't yet know the origin or the strain of the infection. It's important not to speculate on that until we have that information. It's also too early to speculate on what our possible response options may be, including things like alert levels. We don't have the relevant information we need to make any further decisions on that. And as soon as we do, of course, we will keep people informed. Steps to detect or to do the genome sequencing and a second PCR test are underway. That can take around 24 hours for both of those to send the results back in, at which point we will share those and provide a further update. Until we get a clear picture, we're asking New Zealanders to do what they have been doing all the way along in our COVID-19 response. So I want to reiterate the key public health messages. Please, if you're feeling unwell and showing symptoms, please get a test and then isolate until you get the results of that test back. Don't go to work if you are feeling unwell. Please do use the COVID Tracer app to scan everywhere that you go. Turn on Bluetooth and wash your hands. Now, I want to be clear here, turning on Bluetooth does not mean you should stop scanning. We want people to do both of those things. I also want to stress, because whenever we raise details about an individual's case here, there is a lot of public opinion on whether the person has done the right thing or the wrong thing. This woman concerned has been scrupulous in keeping a good record of her movements, scanning the QR codes everywhere she has gone. That's laid a very good foundation for our contact tracing team to do what they need to do now, and that work is well underway. So I want to acknowledge that. In a moment, Dr Bloomfield's going to provide more information that we have on the individual case, the actions that the Ministry of Health and other health agencies are taking. I'll then give a few quick updates on the steps we're taking at the Pullman Hotel and with regard to people at the Pullman Hotel. And then we will take your questions. So, Dr Bloomfield.
Thank you, Minister. Kia ora koutou katoa. So as the Minister's just outlined, we are investigating this positive test result in the person who recently travelled back from overseas. In this case, the person had travelled in Spain and the Netherlands late last year. While in the Netherlands, she was with family members, all of whom were well at the time, but subsequently one or two of those family members have tested positive for COVID-19. The person travelled to New Zealand from London, stayed at an airport hotel there, en route to New Zealand via Singapore, and arrived in Auckland on the 30th of December. 14 days in managed isolation, as the Minister mentioned, in the Pullman Hotel, and while there returned 2 negative tests on the 2nd and 10th of January, and did not have symptoms while in managed isolation. After meeting requirements for release from managed isolation, she left on the 13th of January and returned home to Northland. She lives with one other person, and that person has not been symptomatic, but has been tested and is also isolating while awaiting results. Now, as part of our routine follow-up of everybody who's been in managed isolation, they are called 3 to 5 days after leaving, and this person was called on the 16th of January, I understand, and at that stage had reported no symptoms. On discussion with the Medical Officer of Health today, she noted that she started to develop very mild symptoms on about the 15th of January, and these got progressively worse over the period before she was tested. Now, those initial symptoms were just some muscle aches, and as you can imagine, in someone who's been through managed isolation, had 2 negative tests, she did not associate those mild symptoms with anything that could be COVID. But once she recognised that the symptoms were getting worse, she did the right thing and was tested at a community facility. She's been self-isolating since she took the test. The result came back late last evening as positive for COVID-19, and we are doing the further follow-up testing, which we routinely do just to confirm the result. The CT value suggests that it's a new case, but we are doing serology as well, just to rule out that this might be an historical case. We are also doing, as the Minister mentioned, the whole genome sequencing as quickly as possible to check what the type, the variant of the virus this could be, and indeed whether there's any link to other cases that were in the same managed isolation facility as this person at the same time she was there. We are working on the assumption that this is a positive case and that it is a more transmissible variant, either one of the one identified first in South Africa or the UK, or potentially Brazil, or another more transmissible variant. Given where we are in this global pandemic, the variants that are becoming more common are the ones that are more transmissible. After release from managed isolation, the person did travel around the southern part of the Northland region with her husband. Thorough interview has suggested just 4 close contacts, and those people are all being spoken with, isolated and tested. Interviews will determine if they too have close contacts, and those people will in turn be isolated and tested accordingly. In this case, we are also casting the net wide to ensure that we contain any potential community transmission. This is precautionary, but vital as part of our response. We need people to be vigilant and do the right thing. There is a number of locations, roughly 30, where the case has been in the 5 days or so after she left managed isolation in Northland. She was extremely assiduous in using the NZ COVID Tracer app to record QR codes, and this has meant we have been rapidly able to identify locations where she has been. Our team is in the process of contacting those places. As soon as we have contacted them, we will put information up on our website, and we will also send push notifications to people who had been there. I should also say I've just found out that the person had the Bluetooth functionality turned on her app, and so we'll be pushing notifications out through that separate functionality in the app as well. So we will publish the list of locations, potential exposure dates and times, and we're asking people who have been in those locations to stay at home and to call Healthline to find out the right time to get a test. Our advice is 5 days after they may have been potentially exposed. Healthline will be able to give information to anyone who has been at those locations and also where they can get tested. For those people who may have been in those locations who didn't use the COVID Tracer app, we need you to jog your memory. If you were in those locations at around the times you think are relevant, then please be precautionary, isolate and call Healthline about getting a test. As always, anyone who has health concerns can contact their GP or call Healthline for advice. I should say if anyone is symptomatic, either in Northland or elsewhere in New Zealand, the advice is to get a test, and we want people to still do that. And finally, we are standing up, or the DHB is standing up extra testing centres in Northland, including the southern part around Mangawhai, and details will be put online, and Healthline will have information about those additional testing centres and the timing for them. This is a reminder to all of us that the pandemic continues, that this is a tricky virus, and it behoves all of us to get with the program and do the things we all know need to be done to keep New Zealand safe. Wash your hands, scan in religiously, and stay unwell if you are home, and stay home if you are unwell, and get a test and isolate until you receive a negative result. Thank you, Minister.